Okay, so this presentation is going to go through the muscular anatomy of the foot. On this first slide, you can see that I have highlighted the plantar fascia, and it's commonly called the aponeurosis. So that's the bottommost layer of your foot musculature. Then we're going to go into the first plantar layer, so meaning the bottom of the foot, what they consider the first layer of foot musculature. Because remember, the plantar fascia is technically going to be considered a ligament. Okay, so on this slide I am showing you the flexor digitorum brevis. If you remember from last year, we had the flexor digitorum longus, and these tendons that I'm circling right here are those tendons, and they come down and attach to the distal interphalangeal joint. Whereas the flexor digitorum brevis, their tendons are going to stop short on the intermediate interphalangeal joint. So you can see the ends of them right here. That's technically right at the intermediate interphalangeal joint. Okay, next we're going to have the abductor hallucis. So remember, hallucis means big toe. Abduction would be moving away from the center. So in this, you're thinking of the center of the foot, so along this path here. So it's going to pull the toe this way into abduction. Okay, also we have the abductor digiti minimi, which goes to the little toe. So digiti minimi is the little toe. And again, if you think about this being the center line and it's going to move away from the center, in abduction, it's going to pull your little toe out. Okay, then we're going to talk about the second plantar layer. So in this next view, some of the stuff is going to be removed, but I'll put them out. Okay, so in the second layer on the bottom, we have the quadratus plantae, which is the blue highlighted here. You can see the tendons of the flexor digitorum coming along here. So this is the flexor digitorum, and then branching, flexor digitorum longus, let me clarify, and that's branching out into the toes. Okay, so these are the muscles that we just talked about. There's the abductor digiti minimi, here's the abductor hallucis, this one right here. Okay, to kind of get your bearings. And the next one in there, we've removed the flexor digitorum longus, so you can see the lumbricals highlighted there. You're also going to be able to see those on the top of the foot. They're just muscles that are in between every metatarsal. And then here is another view of the quadratus plantae. Oops, sorry about that. And this is the quadratus plantae right here. And that, remember, the flexor digitorum covered up the end of this before in the other view. Okay, and then in the third plantar layer, we're going to, you can still see the other layers there. I didn't remove them, but you can see the flexor hallucis brevis here. And remember, flexor hallucis longus is going to go to here, so that's what this tendon is along this path, and then the brevis just stops shorter. So because our great toe only has 2 phalanges, it's going to go, the flexor hallucis brevis is going to stop just after the metatarsal head on the first phalange. Okay, and then we have the adductor hallucis. So again, remembering our midline, so adduction means moving towards the midline. This muscle, if it contracts, is going to pull towards the middle. You can kind of see how it branches out here. If it contracts, it's going to pull the big toe in towards the middle. Okay, and then we have the flexor digiti minimi brevis. Again, it's the flexor, so it's on the bottom of the foot. It's going to the digiti minimi, which is your pinky toe, and then it's a brevis, so it stops short. And that's what's highlighted in that picture. Okay, so this is the top view of the foot, and we're going to talk about the extensor digitorum brevis. If you remember from last year, we have our extensor digitorum longus, and their tendons are coming all the way out to the distal interphalangeal joint of all 4 toes. The extensor digitorum brevis stops short on just the second, third, and fourth toe. You can notice that it's stopping here. So it's stopping on the intermediate interphalangeal joint of the second, third, and fourth toe. And it's not on your pinky toe. Okay, and then extensor hallucis brevis goes to the great toe on the top. Okay, a couple other things that I want to point out. If you look right here, this is the extensor retinaculum. All of this tissue is going to be there to hold down the extensor tendons in the foot. And then you can notice right here is the peroneal retinaculum. You can see the peroneals coming down there and attaching. That's the peroneal retinaculum. You also have the flexor retinaculum on the inside, which you can't see in this view.